N-Acetylcysteine is a powerful antioxidant. It can boost mood, lower anxiety, improve memory, and reduce compulsive behavior. N-acetylcysteine is a derivative of the naturally occurring amino acid L-cysteine, and it works primarily by helping to restore your body's natural antioxidant glutathione. As the most abundant antioxidant in your body, glutathione is responsible for maintaining oxidative balance in each of your cells. Taking glutathione as a nootropic supplement does not adequately restore the glutathione levels in your brain because it can't cross the blood-brain barrier. This vastly underrated nootropic, N-acetylcysteine, easily penetrates the blood-brain barrier and raises the glutathione levels in your brain. N-acetylcysteine has been used to treat acetaminophen poisoning for decades. Every year, there's around 56,000 emergency room visits from Tylenol overdose, resulting in at least 100 deaths. N-acetylcysteine provides the glutathione that your liver needs to fight off the metabolites in Tylenol that does the severe liver damage. As a nootropic, N-acetylcysteine helps to prevent glutamate toxicity, boost dopamine, and to reduce inflammation, oxidative, and free radical damage. N-acetylcysteine is a precursor of glutathione. It's a potent antioxidant, anti-inflammatory, and free radical scavenger. Your brain is especially vulnerable to inflammation, free radicals, and oxidative damage, affecting cognition, long-term potentiation, memory, and mood. N-acetylcysteine modulates glutamate levels and dopamine release in the brain. Excess glutamate in the brain is toxic to brain cells that are affecting neuron health, cognition, memory, and mood. And N-acetylcysteine protects the dopamine receptors, influencing dopamine levels and function in your brain, even protecting dopaminergic nerve terminals from chronic methamphetamine use. N-acetylcysteine reduces irritability, anxiety, and depression. It increases your body's antioxidant capacity, and it balances excitatory and inhibitory neurotransmitters in the brain, resulting in less anxiety and depression. L-cysteine is naturally produced in your body using the amino acid methionine. You can also get L-cysteine from eating ricotta and cottage cheese, yogurt, pork, chicken, turkey, duck, wheat germ, and oat flakes. But acute stress, illness, or a poor diet can deplete the L-cysteine levels in your body and your brain. The quickest and most efficient way to boost the levels of L-cysteine is to supplement with N-acetyl L-cysteine. N-acetylcysteine regulates the amount of glutamate in your brain. Glutamate is a neurotransmitter that's responsible for sending signals between neurons in the brain. This plays an important role in learning and forming memories. But too much glutamate can be toxic to the brain cells. N-acetylcysteine regulates the amount of glutamate, and it keeps it at safe, healthy levels. N-acetylcysteine influences the amount of dopamine available in your brain. It works to keep dopamine receptors healthy and able to transmit and receive dopamine. These neurotransmitters are crucial for cognitive energy and drive, motor control, feelings of pleasure, and focus. N-acetylcysteine is a precursor to the powerful antioxidant glutathione. It's a potent anti-inflammatory, antioxidant, and free radical scavenger. Your brain is especially vulnerable to inflammation, free radical, and oxidative damage. If left unchecked, inflammation, oxidation, and free radicals can negatively affect cognition, long-term potentiation, memory, and mood. As a nootropic, N-acetylcysteine can boost glutathione levels and dopamine levels in your brain. N-acetylcysteine is also used by medical professionals to treat serious cognitive disorders like schizophrenia, bipolar disorder, severe depression, and anxiety. N-acetylcysteine also boosts brain-derived nootropic factor. Oxidative stress results in free radical damage in the brain cells. This leads to neurodegeneration and ultimately Alzheimer's, Parkinson's, and other age-related neuronal disorders. Proteins and DNA are injured. Inflammation, tissue damage, and cellular apoptosis are the result. Users are not immune to the oxidative stress no matter what age you are. Keep this in mind the next time you reach for a Diet Coke. Consumption of the artificial sweetener aspartame induces cortical inflammation and oxidative stress. Researchers did a study with 30 male rats, randomly divided into 3 groups. The control group received distilled water. The second group was given aspartame, and the third group was given aspartame and N-Acetylcysteine. Oral administration was done in the morning daily for 90 days. The study found that N-Acetylcysteine affected the brain-derived nootropic factor levels. It blocked the COX-2 and the PGE2 inflammatory enzymes. It reduced the expression of interleukin-6 and tumor necrosis factor alpha, inflammatory cytokines in the rat's cerebral cortex. They also found that N-Acetylcysteine replenished glutathione levels. The researchers concluded that the N-Acetylcysteine prevented neurotoxicity and it improved neurological function, suppressed brain inflammation and oxidative stress response. Major depressive disorder is one of the most common psychiatric disorders. It's a burden on the individual, family, and the community, and the pharmaceutical companies are making literally billions on selling various antidepressants, not treating the cause, producing a host of side effects, and in most cases just dumbing down the symptoms. But the pipeline for new antidepressant drug discovery is at a near standstill for treating problems like schizophrenia, bipolar, depression, and common forms of autism. The good news is that neuroscience continues to work on the problem, and it's shown that many of these disorders share inflammation and oxidative stress as part of their disease physiology. Neuroscientists also discovered that associated pathways causing these diseases include a reduction in proteins that stimulate neuron growth, increased apoptosis or cell death, and a reduced energy generation in the mitochondria. It turns out that N-Acetylcysteine seems to have multiple effects on all of these pathways. It reduces the core symptoms of schizophrenia, reduces depression, reduces cravings for a number of addictions including cocaine, cannabis, and tobacco. As we get older or suffer from chronic illness, our brain and our body chemistry and energy metabolism changes. Oxidative stress in the brain cells increase. Free radicals damage the neurons. Dopamine receptors stop working. Glutamate toxicity causes cell damage and apoptosis. Brain-derived nootropic factor declines. Mitochondrial energy declines. All of these changes are often attributed to chronic illnesses, lifestyle choices, and aging. Unchecked, they could lead to neurodegenerative diseases like Parkinson's, Alzheimer's, major depression, schizophrenia, OCD, addictions, autism, and a drop in quality of life. N-Acetylcysteine is a slightly modified version of the sulfur-containing amino acid L-Cysteine. When taken as a supplement, N-Acetylcysteine replenishes the intracellular levels of the natural antioxidant glutathione, restoring your cell's ability to fight damage from reactive oxygen species. Conventional medicine has used N-Acetylcysteine for decades as an inhaled mucus thinner for the treatment of cystic fibrosis. N-Acetylcysteine is given intravenously or orally as a treatment for acute acetaminophen poisoning. N-Acetylcysteine quickly restores glutathione levels, averting permanent disability or death. The nootropics community has recently discovered that N-Acetylcysteine is a way to suppress inflammation in the brain. It prevents oxidative stress on brain cells, eliminates free radicals, restores brain-derived nootropic factor, rejuvenates dopamine receptors, and it improves overall cognitive function. It can help to boost cognition, long-term potentiation for long-term memory formation, short-term and working memory, improve your mood, and quell anxiety. Users report that supplementing with N-Acetylcysteine could be the best nootropic that you've ever used for the brain and overall health. Comments can include thinking clearer. This is because N-Acetylcysteine boosts dopamine. Memory improves. Concentration and attention span improves. There's less brain fog, less anxiety, and less depression. People feel less irritable. The mood improves. The symptoms caused by ADHD medicines disappear. Obsessive-compulsive behavior decreases. Sleep quality improves. Energy levels increase. Weight maintenance is easier. Less flu and cold. Skin looks better. They feel younger, and hangovers are less severe. N-Acetylcysteine increases dopamine. Treatment for Parkinson's disease is limited to replacing dopamine in the brain, as well as some medications designed to slow down the disease. In 2016, researchers at Thomas Jefferson University showed that oxidative stress in the brain could play a critical role in the progression of Parkinson's, and this stress lowers levels of glutathione, which is a compound produced in the brain to counteract oxidative stress. Studies show that N-Acetylcysteine helps to reduce oxidative damage to neurons by helping to restore the levels of the antioxidant glutathione. In this study, Parkinson's patients were placed into two groups. The first group received 50 mg per kg body weight of N-Acetylcysteine intravenously once a week, and 600 mg of N-Acetylcysteine as a supplement twice a day on a non-IV day. The second, control group, received only their standard Parkinson's treatment. Patients were evaluated at the beginning of the study and again 3 months later. The evaluation consisted of the Unified Parkinson's Disease Rating Scale and a SPECT brain scan, which measures the amount of dopamine transporters in the brain. Compared to controls, the patients who were receiving the N-Acetylcysteine had significant improvement in their scores. One of the study's authors said, "We have not previously seen an intervention for Parkinson's disease have this kind of effect on the brain." The study demonstrated for the first time the direct effect of N-Acetylcysteine on the brain's dopamine system. N-Acetylcysteine has the unique ability to enable dopamine neurons to recover their function. Traumatic brain injury is a major public health issue affecting 1.7 million Americans each year. It can be caused by factors like a sports injury, a work accident, a car or a motorcycle accident, or a fall. Many survivors end up with long-term or even permanent neurocognitive dysfunction, affecting cognition, motor function, and personality. A major cause of traumatic brain injury comes from blast exposure on the battlefield. Symptoms are similar to other causes of traumatic brain injury: dizziness, hearing loss, headache, memory loss, sleep issues, and neurocognitive dysfunction. In a brain subjected to a traumatic brain injury, there's a glutamate toxicity, free radical injury in the brain, electrolyte imbalances, mitochondrial dysfunction, inflammation, apoptosis or cell death, and a stroke. Acetyl L-Cysteine relieves the traumatic brain injury symptoms. In a double-blind, placebo-controlled study on 81 active-duty service members at a forward-deployed field hospital in Iraq, all the service members in the study were exposed to significant ordnance blast, and they met the criteria for a traumatic brain injury. The service members were randomly assigned to receive either a placebo or N-Acetylcysteine for 7 days. The resolution after 7 days of all of the traumatic brain injury symptoms listed above was the main outcome measure of the study. The researchers concluded that the N-Acetylcysteine was a safe pharmaceutical countermeasure of blast-induced traumatic brain injury, and that further work on long-term outcomes and the potential use of N-Acetylcysteine in civilian traumatic brain injury is warranted. Both depression and bipolar disorders are complicated by glutathione depletion. The researchers in the double-blind, multi-center, placebo-controlled study worked with 75 subjects with bipolar disorder. The subjects received 1 gram of N-Acetylcysteine twice a day for 24 weeks. The N-Acetylcysteine treatment causes significant improvement with depression with those using the N-Acetylcysteine. The researchers concluded that N-Acetylcysteine appears to be a safe and effective augmentation strategy for depressive symptoms, in this case with people who are suffering from bipolar disorder. Suggested dose for cognitive benefits is 500 mg 3 times per day. Clinical studies have found that doses up to 2,000 mg per day are safe and effective. One German study showed the safety of 2,800 mg per day for 3 months in patients with cystic fibrosis. N-Acetylcysteine has also proven to be effective against seasonal influenza and flu-like illnesses. One large study of older adults in Italy took 600 mg of N-Acetylcysteine twice a day for 6 months. Only 25% of those adults who used the N-Acetylcysteine experienced flu-like episodes compared to 79% in the placebo group. N-Acetylcysteine is the N-Acetyl form of the naturally occurring amino acid L-Cysteine. It's considered non-toxic and very safe. It's a slightly modified version of the sulfur-containing amino acid L-Cysteine, so N-acetylcysteine in powder form can have an unpleasant smell. Very rarely can N-acetylcysteine cause nausea, vomiting, diarrhea, or constipation. Even more rare are rashes, fever, headaches, drowsiness, low blood pressure, and liver problems. Side effects can be a result of very high doses of N-acetylcysteine, and if you have a genetic condition called cystinuria, don't use N-acetylcysteine. This rare condition causes stones to form in the kidneys, the urethra, and the bladder from cysteine. One study also found that long-term use of a high dose of N-acetylcysteine can deplete your body's stores of zinc. So if you're using N-acetylcysteine every day, you should supplement with zinc that is also balanced with a low dose of copper. Most of us don't get enough N-acetylcysteine from our diet, so supplementing with it can help. And N-acetylcysteine is highly bioavailable, so you should feel its effects faster. N-acetylcysteine is helpful for most users to improve mood, memory, cognition, and concentration, and it helps to alleviate brain fog, anxiety, and irritability. It's especially helpful to people dealing with obsessive-compulsive disorder, and it can be taken with ADHD meds. It helps to alleviate some of the negative side effects that are associated with stimulants.